I'm Molly Schneider. I'm a second-year medical student here at the U. And I would like to just reiterate the gentleman's concerns about the sequestration and concerns to medical students as, we're already concerned about the bottlenecking that's happening with residencies, and with further cuts to Medicare, that's obviously not going to help fund the uni. And so we were just wondering what your thoughts were concerning if this does happen, if, maybe funding of GME is like privatization, maybe by pharmaceutical companies or insurance companies. And just your thoughts on that, and if this happens, if government will play a role in regulating this.
Well, as far as the GME, it's going to be taken care of, whether it's before or after. The problem with waiting until afterwards is that it becomes extraordinarily expensive because you go to all the contracts that you have in place at that point, and you have to go back and renegotiate. And just government-wide out, the defense industry is going to be extraordinarily expensive to cancel all those contracts and then reissue them again. And the same thing in the research area, it is going to be taken care of. It's just a matter of how much pain we have to go through and how expensive it has to be to take care of the problem. But I think it'll be okay.
So we're starting to run out of time. One more question.
Yeah, there she is, that student body president again.
Prerogative of presidents.
We have talked quite a bit about new healthcare, but I was wondering if you feel like Mr. Ryan's plan to reduce spending in Medicare relies too heavily on competition in the private sector, and what if that competition doesn't pan out the way that I would think that happen?
The only cuts, reduction in spending in Medicare are in the president's health care. $700 billion is cut out of Medicare after people have paid into it all of their lives, and now is being used to fund a separate new entitlement that has nothing to do with Medicare. What Mr. Ryan is talking about is the same level of support of traditional Medicare. You have the option either of traditional Medicare or a comparable. It has to have at least the same coverage or greater and be at the same price. So, no, you have the option of staying in. This affects nobody currently in the system. Those that are coming in the next 10 years would not be affected. But what it does is that it is competition. It will save money, keep that money in Medicare. And again, the president's health care plan is the only plan that cuts anything out of Medicare. That's $700 billion. So,
Okay, Jim.
In terms of competition, isn't that what the Medicare Advantage plans are supposed to kind of pilot, is to show that the private sector can compete in this arena, and hasn't that been an abysmal failure because they're relying on these government overpayments or subsidies?
well, let me just say that Medicare Part D prescription drug came in 40% less than what the projections were because of competition. That's according to the Congressional Budget Office. That plan cost 40% less than what CBO said it would when it was enacted because of competition. Because you had companies, insurance companies, competing against each other, holding down the price. And that's the same model that we're talking about. Either you have the choice of staying in traditional Medicare or a plan with at least comparable benefits that would probably cost less. If it does cost less, there'd be bids put out. The second lowest would be the one chosen, probably less than what the Medicare reimbursement is. If you pick the lowest, you would actually get a check back from Medicare. But the way they're going to have people come into the system is through additional benefits that which you have in traditional. That's what happened. And Medicare Advantage plans that's why there's over, I believe it's close to 95% of their Medicare Part D plans right now, including especially the Medicare Advantage plans. People have them loved, and they've been a great success.
Congressman Tony Latham registered it, and what James would be saying though is those Medicare Advantage plans cost more than traditional Medicare. And if I can describe that sounds pretty similar to Medicare Advantage. How do you see it saving money?
It saves money in that the bids will come in Medicare. They will come in less than what we're currently paying in Medicare. And to get people to go into those policies, they will offer additional benefits. And if the lowest cost, if you would choose that one, you would actually get a check back.
But that's what they said when they came up with the original version of Medicare Advantage. They had to.
For the recipient, the Medicare Advantage program is very, very reasonable cost. Very cheap. Well, it is subsidizing the rest of it.
We are out of time. I'm sure the congressman would be glad to entertain individual discussions, but on behalf of the partnership, I want to thank the congressman for being with us.